Hello, doctor. My name is Muhammad Bassam Saidawi, and in today's video, I'm going to make the scale of the abdominal assessment. At the first, I'm sure I have done with the hand hygiene and close the door of the room for the privacy of my patient. So at the first, I'm going to introduce myself for my patient. Hello, sir.
Hello.
My name is Muhammad Bassam Saidawi, and I'm your nurse for today. I hope you are doing well. Can you please tell me your triple name
عمر فايق أبو غزير
and the date of birth?
7/9/2001.
Okay, so sir, today I'm gonna to make the abdominal assessment for you if you agree.
Okay.
So for the abdominal assessment, I'm gonna to start with the inspection, auscultation, percussion, and palpation. So at the first, I'm gonna to make the inspection for my patient abdomen. So I'm looking for if there's any scars or any abnormal color of my patient abdomen. So, for my patient today, Mr. Omar, his abdominal is all good. There is no any abnormal color or any scars or anything else. So, I'm gonna to start with the auscultation. At the first, I'm drawing imaginary line for his abdomen. So, I'm gonna to start with the right lower quadrant, then the upper right quadrant, then the left upper quadrant, and lastly the lower left quadrant, and move in a clockwise. So at the first, I'm gonna to make the auscultation. Okay, so at the first one there is 12 sound for the vowel. And in the second one there is 10 sounds of the vowel. And we have here 11 sound of the vowel, and in the last one. And here I have also uh, 11 sounds of the vowel for my patient. Sure, I have at the first asked my patient when was his last meal, and if he wanted to void, his answer was no, and for the last meal, his answer was before 3 hours and a half. So for my patient now, his abdominal is active, and if there was 1 to 2 sound per 1 minute, I'm gonna to make one additional minute, and if there is also 1 to 2 sound per minute for the additional one, so my patient will be hypoactive abdominal sound, and in the verse if there is more than 35 sounds per minute, my patient would be hyperactive for the vowel sound, and if there is no sound, if there is no sound for 1 minute, I'm gonna to make additional for 5 minutes. If there is also no sound, my patient would be at the absent active for the abdominal for the vowel sound, and in the in the hypo active vowel, maybe because of the surgery or something like that that make the abdominal the bowel be hypoactive, and for the hyperactive, maybe because of the diarrhea or other things, and for the absent maybe because of the surgery that my patient have done, and it made the paralytic lysis ileus. And now I'm gonna to make the percussion for my patient. So with my dominant hand, so here the sound of the vowel was timpani, and the expected one is timpani. Uh, and now for the last thing that I have to done is the palpation for my patient abdomen. Can you please bend your knee? Okay, I'm gonna to palpate the abdomen and watch my patient face. Then I'm going to ask my patient if he feel any pain.
No.
Okay. So in this stage, the expected result is soft and relaxed abdomen. And if there is anything abnormal, the abdomen will feel ridge and painful for the patient. With that, I have done with my skills for the day. Thank you.